Welcome to the Lunch and Learn with Dr. Barry. This is episode 14.
Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to the Lunch and Learn with Dr. Barry. This is episode 14, and we're going to be talking about questions that you should be asking your surgeon before surgery. And again, if you want today's show notes, please go to drpierresblog.com/LLP014. Again, if you want today's show notes, please go to drpierresblog.com/LLP014. And again, today we're going to be talking about questions that you should be asking your surgeon right before you have surgery. And what kind of prompted this lesson today is that as a primary care physician, I had a lot of patients, and I deal with a lot of patients who come in for pre-op workups. But a lot of times they're asking me the questions that I feel that they should probably be asking the surgeon. I want to put something out there just so they can have, a general base of questions that they know they should ask before going into surgery. So stay tuned and get ready for another great episode. And I wanted to kind of touch on the pre-op visit, right? As a practicing internist, it is something that I do probably 3-4 times a day, every single day of the week. So I'm very in tune with doing the pre-op visits. But I've noticed an uptick of patients asking me the questions that they probably should be asking their surgeon, and that's okay. I'm here to educate like always, but I just wanted to kind of put that out there. And if anyone has any suggestions, also let me know of any questions you think your surgeon should be asking you as well. But today, again, so number one, right, is I think probably the easiest question that you should be asking the surgeon as far as when you're going to have a surgery. One is how long am I going to be in the hospital, right? So number one, how long am I going to be in the hospital? Because I have a lot of patients, they're undergoing a procedure and they're not sure if this is an outpatient procedure, which means that they're going to go to the hospital, get the surgery or whatever the procedure is done, and then go home afterwards, or they're in for a long hospital stay afterwards. And I think that's important, especially when you're trying to plan out your plans with family members and you're trying to coordinate, your expectancy that's going to be in the hospital. It's definitely important to know, like, hey, how long am I actually going to be here? So, how long am I going to be in the hospital? That's the number one question. Number two, what is a normal recovery time? And the reason why I have to stress the word normal, because we understand that, everything isn't going to be perfect. We want it to be, but everything is a possibility that everything's not going to be perfect. But you kind of want to have an idea how long, especially for my patients who are going to be in the hospital for a few days, you want to kind of have an idea how long you're going to be in the hospital for. Because if you go in and you're not even aware that your normal procedure is probably going to keep you in the hospital for 2-3 days, then you can't. Then you start getting mad after 2-3 days when you're not discharged. You can kind of avoid some of that stress. So number two, always ask your surgeon, how long am I normally going to be in the hospital? If I'm going to be in the hospital, 2-3 days, 1 week, hopefully not longer than that, just depending on the surgery. From that standpoint there. And I think number three, a big one for me is, and I always get this question, is like, when can I actually return to doing normal, my normal life activities? When can I, work again? If my work includes any lifting of things or lifting of people, when can I go back and do that? That's extremely important because, we don't want to go ahead and rush going back into your quote unquote normal activities, and then you cause a problem with the surgery, which could cause you to have another surgery, which could cause pain that we could have avoided. So definitely you want to always get a timetable. And you see, I'm big on the timetable, right? Like I want to know, how long the surgery is going to be. I want to know how long I plan on being in a hospital. I want to know if I'm even going to be in a hospital. I'm big on that. You want to kind of know what's going on, and then kind of ducktailing into your normal activities. You want to know what are some of your restrictions, just depending on what type of surgery you have, whether it's gallbladder, whether it's appendix, hernia, C-section, not C-section, but like ovaries taken or something. You want to kind of have some type of idea of what you can do afterwards and what you can't do, and the reason why you want to have that idea is because, let's say your job is you work in the health field, you're lifting people, but you have some type of surgery that says you can't lift anything over 10 pounds. That's a lot of pain that may immense if you go get back to trying to do your activity a little bit too soon. So we definitely want to try to avoid getting overstepping our boundaries from a restriction standpoint. And another reason why I'm big on trying to get a time frame as far as when you should do things or how long should you last is because, let's say you have a surgery where the pain is and usually surgery pain is usually the worst during surgery, a couple of days after surgery. But let's say we're talking about 1 week, 2 weeks later, and we're still dealing with this same type of pain. You got to have some type of idea and say, hey, you know what? Doc said after 2 weeks I shouldn't be having the type of pain I'm having, and I'm still having this pain. So let me follow up with him and make sure there isn't anything I need to do extra from that standpoint there. And a big thing, especially for me as the primary care physician, right? So like the last one, number 5, big number 5 for me is there any medications that I should be holding off or holding on to or continuing even on the day of surgery? Because I know a lot of our times the surgeons will tell you, don't eat anything the day of the surgery. But we know that there are certain medications that if you miss it, and even if you miss a dose for 6 hours, 8 hours, we know problems can arise. So I think it's definitely important to know what medications the surgeons want you to hold off and what medications you're allowed to take. And when I say medications, I'm not even talking about prescription medications. We're even including natural supplements. I know I have a lot of patients in my practice who take a lot of natural supplements as well, which sometimes can serve as almost like blood thinning medications. So they know not to take their aspirin. They know not to take their Plavix or anything, but then they end up taking, some other herb that kind of acts like aspirin and Plavix, and then a problem can arise in the hospital. So definitely want to make sure that that's not the case for you going into surgery. So we talked about 5 quick things that I want to make sure you guys are asking your surgeons. And again, I wanted to touch on this because I've noticed I'm getting a lot more questions about it than I probably should. How long is my surgery? Number 1 is how long is my surgery? How long am I going to be in the hospital due to surgery? So you want to know, is this a type of surgery where I'm going to be in and out the same day, or I'm going to stay for a few days? You want to know what's a normal recovery time for the surgery. You want to know how long before I can go back to normal activities. Number 4, you want to know what type of restrictions I have after the surgery is done. Am I not allowed to run anymore, allowed to jump anymore? What things can I not do since I just had the surgery? And the big one for me, number 5, it could have been easily number 1. Is there any medications that I should be avoiding right now? Or 5 days before, or 3 days before going into surgery. So those are my big 5 key points. Like always, I will post this on the blog. Like always, I will have a follow-up blog post probably tomorrow on it regarding some more. And I got there's a lot of questions, but I just wanted to hit on the 5 I think that are important. You guys have a great and blessed day. I'll see y'all later.
Thank you for listening to this episode of The Lunch and Learn with Dr. Barry. If you want to find out more about the episode, please go to www.lunchlearnpod.com. That's www.lunchlearnpod.com for the show notes and any links that may have been mentioned in today's episode. If you're interested in joining the Lunch Learn Pod community, head over to either the website lunchlearnpod.com or join us on Facebook and Twitter with the same username, Lunch Learn Pod. And again, you can find all of these links on the website. If you have any questions, any comments, or any requests for topics to debut on the show, please let that be known. And don't forget to use the hashtag LunchLearnPod when you're listening to the episode. Again, I want to thank you for taking the time to listen to today's episode, and I'll see you next week.